Hi there, this is Catherine at Arcadia Physiotherapy. I'd like to tell you a little bit about activating your lower abdominal muscles. This is really important for core stability and also your brain-body connection. Why the core is important, there's a lot of controversy about this in the literature, but really it's there for stability. So our centre of gravity is around here. If we put our arm out to pick up a cup of tea or something, then that centre of gravity has to be stabilised before we can pick up that load. And so in everyday things that you do, your core is working. If the abdominals aren't strong or aren't working effectively and switching on at the right time, then other muscles are going to start to do it. That could be your neck straining a bit, probably your lower back pulling a bit too hard, and having effects further down the legs as well. The body finds a way, and it often doesn't tell you that it's overcompensating until things are quite far down the line and you end up with back pain or shoulder pain and so on. So what I'd like to do is just to talk through a very simple but kind of confusing technique that lots of people find a little bit hard to get engaged with. So I'm just going to talk through it slowly and see if that helps you with your exercises. So if you're lying on your back in a nice bent knee position, and if you find your hip bones, those bony bits at the front of your pelvis, and just bring your fingers in a couple of inches to the soft tissue at the lower part of your tummy, just below your belly button. If you give yourself a little cough, you'll feel these muscles push outwards. What we want you to do is to bring these muscles upwards and inwards. So almost think about drawing your tummy button in towards your spine and up a little bit. Another prompt that's quite useful is actually to feel like you're zipping into jeans that are a bit too tight. So really kind of bringing it up from the inside. What I've done here is a classic mistake in that I've brought my breath in at the same time. And if you see my video on pelvic floor, I talked about how the diaphragm actually moves down when you bring your breath in, and that actually pushes your tummy out and your pelvic floor down. So what I'd like you to do is think about just listening to your breath, working out when you're bringing your breath in, your tummy should come out nice and relaxed, and as you breathe out, it should settle down again. So what I'd like you to do is to think about these muscles, and on the in-breath relax, tummy goes out. And then as you breathe out, think about lifting those muscles up and in. So ideally, ultimately, of course, you want to be able to breathe in and out while engaging these muscles. But this is a really easy way of getting yourself engaged with these muscles and working out which bit you're supposed to squeeze and so on. So the first level is really to just start engaging that and feeling these muscles switch on. What you can then do is to start to challenge them. So as I say, the centre of gravity is around your abdomen when you're standing up, and when you're lying down, obviously it's sort of here as well. So what we want to do is to perturb that centre of gravity, challenge it. So what we can do is by engaging our abdominal muscles, as we breathe out, lift them up and in, and then just extend the leg away. And you should feel an initial tilting of the pelvis. We actually want to control that and stop that pelvis lifting and rolling. Also, we want you to stop arching your back, because if you do that, you'll start to feel it strain here, and if your problem is low back pain at the beginning, then you really don't want to aggravate that. So it's important to get the engagement right first, and on the out breath is easier, and then extend that leg away. Bringing it back, and then extend the leg away again. And you should feel that that's working these muscles harder. The next level up is that you can do it with straight legs. The longer the leg, then the harder it is for the body to stabilise it. So again, breathing in, and then relax, and engage those tummy muscles as you then lift the leg. And then slowly down again, keeping that engagement on. Things that indicate you're cheating is arching your back, or really pushing down with the other leg or your shoulder and so on, which will also be compensatory strategies. So even if you think you've got a great core, it's worth trying this activity just to think, actually, how much am I compensating and how much work are my other muscles doing when my abdomen should be doing it. The final level in this position is to do the leg lift, but actually move it around a bit. So breathing in, breathe out and engage, and you can bring it out to the side, and try and drop it down over here slowly and controlled, and I can feel my pelvis sort of rolling that way. So again, by stabilising it, it should challenge you a bit more. I'm bringing it up again and across and down. Like with any abdominal exercise, if you feel your back arching, and you feel you're unable to control it, just bring your knees back again, roll out the back, and just give it a rest. And when you feel ready to start again, then you can reset the back and engage the abdomens before you start lifting off again. So this is a really good start. This is really good for building a foundation before you do anything like crunches or sit-ups, which can often just aggravate problems that are already there and really challenge muscles far too far than they're ready for. So it's a really good stabilisation base, and you will really reap the benefits if you've got lower back pain and abdominal weakness is your problem. So thanks very much for listening. I'm Catherine at Arcadia Physiotherapy, and I hope to see you soon. Thanks very much.